Welcome to RSCH503, Research Methods in Biostatistics, a 3-credit graduate course offered by Drexel University College of Nursing and Health Professions. Nursing research requires specific knowledge, skills, and sustained discipline and rigor built on a foundation of ethics, integrity, and honesty. Conducting research ethically has been a major focus of nursing and other professions, as well as a concern of the federal government. Research misconduct has occurred at several stages of research, from the implementation of studies to the reporting of study findings, and finally to the publication of study results. In 1989, the United States Public Health Service created the Office of Scientific Integrity Review, which became the Office of Research Integrity, or the ORI, in 1992. The ORI is now an independent entity within the United States Department of Health and Human Services and is responsible for overseeing research misconduct. On a professional level, the American Nurses Association Center for Ethics and Human Rights was established in 1990 with 3 objectives. 1. To promulgate a body of knowledge designed to address issues in ethics and human rights. 2. To develop and disseminate information about and advocate for public policy to ensure that ethics and human rights are addressed in healthcare. And 3. To assure that objectives regarding ethics and human rights are addressed in the ANA. Research ethics has been a focus since the 1940s due to mistreatment of humans in selected studies, several of which are landmark cases reviewed in this session. The Nazi medical research programs during World War II from 1933 to 1945 involved sterilization, euthanasia, and experiments to produce a pure race. In 1949, after the end of the war, the Nuremberg Code was developed with guidelines regarding voluntary consent of subjects, the right of subjects to withdraw from studies, protection of subjects from harm, and the balance of benefits and risks in research. In 1964, the World Medical Association developed the Declaration of Helsinki. This declaration distinguished therapeutic from non-therapeutic research. Therapeutic research considered studies giving subjects the opportunity to receive an experimental treatment that might have beneficial results versus non-therapeutic research conducted to generate knowledge for a discipline, the results of which might benefit future patients. The Tuskegee syphilis study from 1932 to 1972 was conducted by the United States Public Health Service to study syphilis in black men in Tuskegee, Alabama. The study was discontinued in 1972 after an article in a newspaper concerning the study outraged the public. The Willowbrook study, conducted from the mid-1950s to the early 1970s, studied children in an institution for the mentally retarded who were deliberately infected with hepatitis virus. Lastly, in the Jewish Chronic Disease Hospital study conducted in the 1960s, patients were injected with live cancer cells to ascertain rejection responses to such cells. The Journal of the American Medical Association, or JAMA, recently included a link to the 7th edition of the Declaration of Helsinki in its online version dated August 6, 2015. Nursing, medicine, and other health professions provide for codes of ethics for their members to follow. Such codes are initially reviewed in educational programs and subsequently reinforced in their professional journals and other publications. The former United States Department of Health, Education, and Welfare constituted the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research in 1974. Several years later, this group developed its report, termed the Belmont Report, that provided 3 ethical principles regarding research involving human subjects. The first principle in the Belmont Report is respect for persons, meaning the individuals have the right to self-determination and the freedom to participate or not to participate in research. The second principle is beneficence, meaning researchers must do good and, above all, do no harm. And the third principle is justice, meaning that all human subjects must be treated fairly. Based on the three principles outlined in the Belmont Report, the United States Department of Health and Human Services developed federal regulations in 1981 to protect research subjects. These regulations are regularly reviewed and revised as needed. You may be interested in reviewing the most current regulations in 2009 that are incorporated in the Code of Federal Regulations. Please note the web link included on this slide. The Office for Human Research Protection, an agency within the Department of Health and Human Services, interprets the regulations for health research protection. Either the United States Department of Health and Human Services or the United States Food and Drug Administration govern biomedical and behavioral studies in the United States. In 2003, the Health Insurance Portability and Accountability Act, commonly referred to as HIPAA, was passed by the U.S. legislature to protect the privacy of all citizens' health information. The HIPAA privacy rule established the category of protected health information, or PHI. This rule pertains both to the healthcare environment and to research conducted in healthcare settings. There are four basic human rights that require protection in research. The first is the right to self-determination. This right of self-determination involves four components, including the obligation to treat prospective subjects as autonomous agents and informing subjects of their right to withdraw from a study at any point. Researchers may violate this right in a number of ways. They may coerce subjects, they may deceive subjects, they may sometimes covertly collect data without informing subjects. Subjects' right to self-determination also includes protecting persons with diminished autonomy who may have decreased ability or actual inability to provide informed consent. Another component is protecting persons who are legally or mentally incompetent. Categories of individuals who require protection include neonates, children, pregnant women, adults with diminished capacity, terminally ill subjects, and subjects confined to institutions, for example, hospitalized patients and prisoners. The second human right that requires protection is the right to privacy. Privacy is defined as a person's right to determine the time, extent, and general circumstances under which personal information will be shared with or withheld from others. The information involved may include attitudes, beliefs, values, opinions, behaviors, and records. The Privacy Act of 1974 was passed to prevent invasion of citizens' privacy. The HIPAA Privacy Rule of 2003 extended the privacy rule to include individually identifiable health information, or IIHI. IIHI is considered protected health information. The third human right that requires protection is the right to autonomy and confidentiality. Study subjects have the right to anonymity and the right to assume that data collected will be kept confidential. Confidentiality is the researcher's management of private information shared by a subject that must not be shared with others without authorization by the subject. A breach of confidentiality can occur when a researcher allows an unauthorized person to gain access to the study's raw data. Fourth, human rights include the right to fair treatment in research. This right is based on the ethical principle of justice. Fair selection of subjects and fair treatment of subjects must be assured. Random selection of subjects is one method for assuring fair selection of subjects. Risks and benefits of a study must be fairly distributed. The sampling plan must clearly identify the target population, and the selection of sample subjects must be fair, a process best assured by random sampling. Subjects need to be treated fairly, and informed consent must be respected. This presentation was prepared for graduate nursing students at Drexel University College of Nursing and Health Professions. The primary book used in this research course is The Practice of Nursing Research, Appraisal, Synthesis, and Generation of Evidence, 2017 edition by Jennifer R. Gray, Susan K. Grove, and Suzanne Sutherland. This book is published by Elsevier Saunders, St. Louis, Missouri.